A 20-year-old and an 80-year-old, of a female versus a male, of a smoker to someone who's like a health nut. Every time you feel that tissue in your hand, you need to make the assessment, okay, what's going to look the best in this tissue? And that's where aesthetics can be challenging your whole life. Instead of just, I mean, if it was as easy as just taking a syringe of filler and, hey, here's your 3 points on the jawline and your 2 points on your cheek, well, then you'd be bored out of your mind in 2 years. And you know, and to some degree, if you want to stay in that basic level, you could, okay, but it won't be as satisfying as the whole picture. You know? So this is where you have to get really creative, right? Is, okay, we need a little bit more, for sure right here. For sure right here, right? And for sure back here. Because when she smiles, go ahead and smile, there's like just bone here, right? Now when she smiles, she picks up this. And that's why, you know, a little bit here, but not as concerned, because I doubt when you're walking around, you're like talking to people like this and never moving your face. Like you're probably like smiling and talking. And so you're giving yourself your own natural lift, you know, just by like engaging with people. So what I would say is, let's again, you know, I'll show you, let's blend that radius and versa so you can see that. Because it's such a nice mixture. Or for you can blend your RHA4 and radius. And you can see what that feels like. Add a little bit of lidocaine so you have the strength, but you have a little bit of flexibility and you can feel and see what that looks like. When you have someone where you're like, remember the first movement is just deep in structure. So deep in structure, and then you fill in with soft tissue. You never want to fill in soft tissue first and then go deep. So first thing I'm going to do is, I can see where she's blanching, which is nice, so I know she's numb. And now that doesn't mean they're not going to feel anything. It's just that first poke through the skin is not going to hurt. And I don't want to inject low, right? I know her transverse artery goes through here. So you can actually numb the skin and then move it where you want it to go too, right? But I'm going to go in and I'm going to anchor her and come in, so a little pinch here. And I do always say a little pinch because I never know exactly how numb they are, right? And I'm just gonna go all the way deep until I hit bone. And then what you can do is when you hit bone, you can even kind of bring that up off the bone if you wanna really be sure, right? And I'm gonna just do a nice little dollop of fluid. The reason why I can do a nice amount there is because she's got nice structure underneath it, that it's not gonna be a big ball, right? And so then I'm going to go just above that. Here's another poke, Jamie. And again, I'm just going to bone. I'm just looking for that structure. Okay, I'm going to give her a nice little support here. Perfect. And now I'm going to come up underneath here. And now I'm getting a little bit more into the soft tissue, but I'm still pretty deep. And this is where I am going to aspirate, right? Because now I'm like, okay, I'm pretty deep in there. So with one hand, because if you don't keep that hub right to the skin, how do you know that your needle's not moving, right? If you're switching your hands out, you're moving that needle around. I'm just gonna use my ring finger to pull back, okay? And if you're doing a good aspiration, if you're gonna aspirate, then hold it for a little while, okay? Because that product's still pretty thick. You see how I'm grabbing it with my thumb and my first finger and using my ring finger to push it back? Okay, so that's a good solid aspiration. And now I'm still going to retrograde. I'm not going to put a big dollop of product in. I'm still going to retrograde back. And that's about all I'm going to do on one side. So I never ever do a whole side. Now I'm going to go the other side, then I'm going to come back, and then I'm going to do the other side, and then I'm going to come back. And I just want to kind of, you know, get some product in there, let the tissue kind of calm down and relax, then go to the other side, do it back and forth. Okay, so I'm just going to tilt your head just a little bit. We're going to go in right here. And I'm just going to follow my little lines, just got some just soft tissue, and I'm just going to come straight back, just like that. And then when we go back this way, we'll go here, we'll go in, and you see you'll feel a little bit of that tissue tension, not a lot. And then I'm just going to literally just come back here. Super silky, super easy. And then you're going to go a little bit up here, and then back, and then up, and then back.